Think about a time where you were so hungry or hangry that you couldn't think straight. Think about another time when you, a friend, or family member may have been stressed about not being able to afford rent. When you're stressed about these things, it may be hard to think of anything else, especially your own physical or mental health. These stories are especially relevant when thinking about the extreme burden of cardiovascular disease, or disease related to the heart or blood vessels, in this country and worldwide. 1 in 4 deaths are due to cardiovascular disease. There are widespread differences in who gets cardiovascular disease across economic, racial, geographic, and ethnic groups. Cardiovascular disease is not just caused by an individual's behaviors or baseline levels of health, like some may think. It's believed that social determinants of health, or the conditions in which you are born, grow, live, work, and age, like access to healthy food, housing, and income status, may be important contributors to why some groups get some form of cardiovascular disease and others do not. What if we knew what social factors put you at higher risk for cardiovascular disease and at what time in your life? We could potentially do something to address these broader structural and social factors, like creating local policies to prevent housing evictions, or creating targeted programming to provide Americans with job prospects to allow you and Americans like you to live your healthiest lives possible. My name is Lindsay Zimmerman, and I'm a current PhD candidate at Northwestern in Health and Biomedical Informatics. My research work will be looking at how social determinants of health change from young adulthood through middle age in CARDIA, a cardiovascular prospective cohort study. Using 30 years of data, I will use machine learning to identify patterns in the social determinant variables and evaluate whether they improve the prediction of cardiovascular disease later in life. My research will be the first to incorporate a diverse set of social determinants into the prediction of cardiovascular disease, and will improve our understanding of the pathways linking these social determinant exposures and cardiovascular health outcomes, and help us to improve health equity. This knowledge will help inform more effective social and clinical interventions for maintaining cardiovascular health and improving cardiovascular health that are tailored based on different social determinant profiles identified in the target population. We know that as many as 95% of adults in the US may have intermediate or low cardiovascular health that puts them at risk for cardiovascular disease and events like heart attacks. Therefore, this work has the potential to inform strategic interventions for over 240 million Americans. Thank you.